Welcome to Aging Matters, Berks County Area Agency on Aging's monthly show. I'm your host, Katie Ketchmark. Today we're going to talk about falls and falls prevention. According to the National Council on Aging, 14 million Americans over the age of 65, or 1 in 4, fall each year. 1 in 10 of these falls results in injury or inability to care for themselves or mobility. And in 2021, it caused 3 million hospital visits and 380,000 deaths. So this is a topic impacting many, many seniors. So today my guests are Jennifer Barney, Injury Prevention Outreach Coordinator for Tower Health, and Kate Mitchell, Physical Therapist, also with Tower Health. So I'm pleased to have these experts here with us today. Jennifer, I'm going to start with you. Those are staggering national numbers. Obviously, this must be a huge issue locally if Tower has your position as injury prevention. So how do you see this impacting our community?
Yeah, so unfortunately, the leading reason why someone would come into the trauma department is falls. So we see typically 2,000 falls per year, and those individuals are typically 55 and older. It is important to note, not just locally, but nationally, unfortunately, a lot of times these can cause traumatic brain injuries, hip dislocations, and different things like that. So it really is important to kind of understand what you can do to help support yourself so that you don't have a fall.
So I was really interested to read that once you fall once, you have twice the chance of falling again. So are you seeing a lot of people with repeat falls and greater injuries?
Yeah, that definitely is something that is common. And so again, that's why it is so important to, take a look at your situation if you did experience a fall and find those programs that exist to kind of support your care.
So what are some risk factors that people should be considering?
Yeah, so there's a couple things that you can do in your home, right? So if you wanted to take a look around and see what's the lighting look like in your home, are you able to see? Oftentimes people are getting up out of their bed at nighttime to go to the bathroom, and maybe a light doesn't instantly go on. There's so much technology out there right now that there is a lot of different devices that can just turn on automatically, whether it be a motion sensor night light, or you can actually get these plugs that you can just plug in like a regular light, and it has a remote and you can click that in. You don't have to use Wi-Fi if that's a concern for you. Again, the bathroom can be a tricky place, so you want to take a look and see, do you have a grab bar in there? That's something that you could install or get someone to install. To support a fall. Unfortunately, a lot of times people will use a towel rack to brace themselves, right? And I don't know about you, but when I put those towel racks in, it's not meant to, hold a person. It's meant to hold a towel. So unfortunately, that can really harm someone because it's not going to brace their fall the way they want it to. Again, there's other areas in the home, like your steps, and your carpets. Are they kind of coming up, or are there rugs? Rugs, they look pretty, especially as we're going into these colder months. But if they're loose at all, they really can cause a tripping hazard. So, unfortunately, you might have to say goodbye to that beautiful rug, or you can get things, they're kind of self-adhesive that you can put down to kind of grip that rug to help it from moving. That being said, if you have animals, I would be mindful because that pet hair kind of collects within that sticky backing, and sometimes then, it's not effective.
I thought you were going to say that the animals are a risk.
Oh,
right?
animals are a risk.
In my house, my cats are the biggest risk. So.
And you are right. We have seen that often in the trauma department. Unfortunately, I love animals. I have 3 dogs myself, but you do need to be mindful of those animals, and especially if you're visiting someone and maybe you're not as familiar with what their animals would do.
Good point. Good point. Mm-hmm. So all of this is really scary stuff. So if someone is at home, Kate, and they're thinking, how do I know if I'm at a risk for falls? What are ways that people could figure out their risk?
Well, I think you pointed out the fact that once someone has a fall, they're at increased risk for a future fall. So that's one. Individuals that have a fear of falling. So I meet a lot of older adults who have never fallen, but they are so afraid of falling that they are changing the way they move. They're moving less often. They're reaching for things as they move through their home. They're looking down all the time. That changes their posture. So a fear of falling, a previous fall. If you are having difficulty getting off your toilet, getting out of a piece of furniture, that to me is going to indicate that you have decreased leg strength. And decreased leg strength, we have some basic measures that we always look at when we are screening our older adults. And one of them is the ability to rise from a chair without your arms. And a lot of people think, okay, well, I want to make sure I have my arms when I sit down or stand up to make sure the chair doesn't move, which is a good safety habit. But if that's the way you get up all the time, that could lead to less leg strength or an indication that you don't have the leg strength. So those two would be, all of those things would be indicators of being at risk for falling. Anyone that's having dizziness, people that feel like they're losing their balance when they're moving through their house, if they're always having to touch something. Today, most of our older adults are going to annual Medicare wellness visits with their physicians, and the conversation about falls risk is often done. The physicians are moving through that quickly, so I would advocate to you or try to empower you to let them know, because they're going to ask you if you've fallen. If you say no, they might think, okay, there we go, we've checked that box. But if you are worried about your balance or you're worried about falling, asking for a referral to a physical therapist is a really wise move, because we're experts at identifying your risk factors within your body, how your systems work, and then we have lots of strategies to help you improve your fall risk.
I'm actually really glad that you brought up the discussion with your physician. A lot of people think that falls are a normal part of aging and they don't mention it. Mm-hmm. So what would you say to someone who says, oh, I'm old, I'm just gonna fall?
Right. I hear that all the time. Because I work at Fort Tower Health. I work in the neurologic outpatient physical therapy department, and I'm a balance and vestibular specialist. So I see individuals with falls risk conditions all the time. And I would say that we are really trying to change that mindset. Normal aging doesn't mean you shouldn't be able to walk as far, that it's okay if you are getting weaker, it's okay if you don't have as good of balance. We know as we age, certain systems are going to change. Your vision system, potentially you may lose some feeling in your feet if you have something called neuropathy. A lot of individuals have diabetes, and that can lead to changes in the sensation in your feet. Those two systems, our vision, the feeling in our feet, are 2 out of the 3 primary balance systems. We also have our inner ear vestibular system. So as we age, many of us have vision changes. We may have some less flexibility in our feet or some neuropathy, but just because you have those changes, we can help educate your body to use your other systems, and also getting you a little more stronger, a little flexible, and retraining some hardwired strategies.
Great. Yeah. So Jennifer, talking about screening, I know that Tower has worked together to put together an event with the National Council of Aging. Do you want to take a minute and tell us a little bit about this?
Yeah, so we have an event along with the Berks County Falls Free Coalition. It's going to be on September 25th. We just ask if you can register so that we can have an idea of how many participants are coming. But we're going to be offering screenings such as hearing and grip and balance. The rehab's going to be there as well, but Alvernia students are also going to help support the screenings. We're going to have flu shots, some really great presentations, one on vision, because that is so important, and then also in kind of to continue the conversation in regards to different exercises that you can do and how to utilize those assisted devices. So again, we hope you can join us. It is completely free. We're gonna have pizza there. Again, hopefully you are able to make it out September 25th from 9 a.m. until about 1:30 p.m. The other thing we're going to do is it's called bingo size. It's kind of new this year. It's bingo, but also adding exercises as well to make it fun.
Terrific. And I do want to mention one other thing that's new this year.
Oh, yeah.
We are going to be doing a slipper swap. So we have these wonderful slippers. Right, a lot of falls happen because people have poor footwear, ill-fitting footwear, worn-out footwear. So we have these wonderful Deer foam slippers. We have a limited supply, so register so you get your slippers. But we're going to do a slipper swap. So if people bring in their old, worn slippers,
That's such a great
we're able to swap them for this wonderful pair. So again, that's the Falls Free Coalition at Alvernia on September 25th. Great, great. So Kate, now once someone has determined that they are a fall risk, can they do things to help themselves become stronger and become less of a fall risk?
Absolutely. So what I could do today is show you a couple of exercises to keep yourself moving. But what I would recommend that you do is that you schedule an appointment with your physician or ask for a referral for a physical therapy evaluation. But what I can show you today is just some basic exercises. If you feel like, well, you know what, maybe I just need to move a little bit more, and then from that you could decide whether or not you would benefit from additional activities.
Terrific. Yeah, if you could show us some exercises, that would be great.
Okay. So one of our go-tos, I'm going to just move my chair a little bit, is, I'm not used to wearing that. Can I put that in here?
Yeah.
Yeah. So one of the things that really helps you work on your leg strength, this addresses leg strength, this addresses balance, this addresses fall frequency. A lot of falls happen in the bathroom when people are lowering onto their commode, or when people are getting in and out of bed. You've probably all heard people talk about, like, oh, we don't want you to flop down. So if you're flopping down, that is most likely related to the fact that either you're afraid to lean forward to control your descent, or you have some leg weakness that limits your ability to control it. So one of the best exercises that all balance aware physical therapists are going to give their patients today is what we call repeated sit to stand. So our goal would be for you to not use your arms, but if you're not ready for no arms, then we'll certainly add the arms to start. But let's assume that you're able to stand up from a firm chair, but you probably don't do it that often. You always just do this, and then you do this. But if you watch what I'm doing here, I'm really controlling my descent with my arms. That can become a habit. I might do that because I have some hip pain or some knee pain. But we know that pain is going to be present, but the way to mitigate that pain is to have stronger legs or stronger muscles. So you've got to use those muscles in order for them to get stronger. So let's go back to the exercise. So ideally, the exercise is going to be standing up and then sitting down without using your hands. So you want to have a firm chair. I often talk about like a kitchen chair. There's a lot of recliners out there. This is not an exercise for your recliner, but any kind of firm chair that is going to be sturdy, that isn't going to move, so it's nothing with wheels. So you're going to come up and come down. We're moving into a dosing idea of time versus repetition. So you could set the timer in your kitchen for 30 seconds, and you're just going to work on standing up and sitting down as many times as you can in 30 seconds. You could pair that around your meals. That's one of the other things that we talk about. Making time for exercise can be hard to do if you're not someone that's always been an exerciser. So if you think about doing this around your meals, and that would be the perfect place to do it, that would be a safe place to do it, you would get into the habit. So you could set that kitchen timer, or if you have a watch or a phone, all those have timers as well. Now, what if you can't do it safely without your arms? Start out with light arm pressure, letting go as soon as you can, and then light pressure where the legs drive you and the hands are just for balance. So that would be the modification for that one. The next exercise, again, you could do this in your kitchen. I would say the back of the chair, or we often recommend the kitchen counter for this next one. So let's assume this is my kitchen counter. That's going to be a little bit higher than this chair. If this I'm going to be coming up on my heels. Maybe I come over here a little bit. So does that help? So I'm going to be coming up on my heels. And you're thinking, well, why would I want to do that? This calf muscle is really important for helping us get up and down stairs, for when we need to change our walking speed, and when you need to reach up into those high cabinets. So these calf raises, again, you could do your 30 seconds, or you could go ahead and start out with a basic set of 10 and increasing that up to 30 times if you wanted to. The next thing that I really like is a side step on the kitchen counter where you're going to be moving along. You're using these side hip muscles, which often don't get used as much in our everyday walking forward. These are helpful for stabilizing our hips when we're going up and down steps, curbs, again, getting off of low surfaces, all places where we could fall. So the counter is a nice, safe place to do this. So if you're someone that uses a walker, you can still do this. You can do all of these exercises, even if you're using a walker. Okay. Another one that I would like is along the strength and mobility side would be holding onto your counter or your chair and just doing an arm raise. You're thinking, well, why does that matter with balance? But I'm trying to combat that posture that we often develop with our technology or as we age. So you're going to start out with arm raises, and your head could follow. If that feels easy, you can make it a little more challenging by doing, we call this a bird dog, modified bird dog exercise. So I'm moving my leg back and my arm up. So you could break that up, just leg, just arm, or both. And this really feels good because we often don't move our head and our back in that direction that often today. So the nice thing about this, you always have that supportive surface. So those would be probably the good strength ones. And then if I want to tap into our inner ear balance system, which we have to really force ourselves to use in isolation. So to do that, I would have us think about, again, we could have the chair here or the counter. We're going to start by moving our feet close together and holding on to the chair. We come back here. If that feels easy, you can let go. Okay, so that would be our base. We're just standing with our feet together. By putting our feet together, our sensation in our feet is less. If I start turning my head, I'm tapping into that inner ear system. So I'm just standing like this, moving my head side to side. If I don't do that often, I might start to get a little sway. Sway is okay. That's our body trying to do its job. So I might want to put a light hand down until I can do that without holding on. If I'm ready to progress that, the next thing that I could do is put my feet a little bit apart, and now I'm going to close my eyes. Here I take away my vision, so I'm going to have to use my inner ear system more. So as a physical therapist, we're always looking at ways that we can tap into the two of the three systems, because sometimes one of the systems isn't available. Like Jen mentioned, if we're moving around in the dark, our vision isn't as available to us. So standing with our eyes closed, if it's easy with your feet apart, the progression would be with your feet together. No matter how old you are, you should be able to stand with your feet together and your eyes closed for 30 seconds. Now, you don't do that often. You might do it in the shower, but you might be holding on. So in order to maintain your confidence with bathing or moving around in the dark, standing still for 30 seconds while your coffee heats up, while your coffee brews. Some of my patients say this is as long as it is for the Keurig to work. So there is time for you to do this throughout your day. You could do it after you get out of the shower in the morning, after you dry off, just stand quietly with your eyes closed for 30 seconds. Even doing that throughout your day is going to help your inner ear system to continue to be activated and pushed to do its job as more efficiently than it may be if you never try to push those things. I think those are some of my basics. I don't know if there's any others that you would want me to show.
Well, I think this is great because as you're talking, I'm thinking people of any age
Yes.
could do these and
yes.
start doing them.
Yes, we can always improve our balance if we work on it. So what we know about our nervous system today, which includes the nerves from your feet and your inner ear and your brain, is that by practice we can improve it. So all of us could work on that. So if you don't stand with your eyes closed go ahead and do that tonight and see how you feel. If you sway, keep practicing.
I think it's a little scary, right? I'm wondering
That's right.
how I would do.
So I'm going to give you that little counter touch. Yeah.
Great, great.
So.
And then when you do it and you're uncomfortable,
Right.
and so you just call your doctor and say, hey, make a referral?
Sure,
Is it that
absolutely. Yes, yes. If you could say to your doctor, I learned about some balance exercises, I tried them, I didn't feel safe doing them, or I learned about some falls risks and I think I have a few, I'd like a referral for physical therapy. They can write that referral, they can put it in your medical chart, and oftentimes today that will then trigger, if you're part of Tower Health, it would certainly trigger a call to you to get scheduled for a balance evaluation.
simple? Terrific. And then I also see you brought a cane with you.
Yes.
So I know a lot of times people go to the store, buy a cane, or someone gives them a cane.
Correct.
Are there tricks to using the cane well
Yes.
or properly?
There are. And I encourage you to consider buying your cane at the cheapest location you can buy it. So many people want their insurance company to pay for the cane. Depending, if you already have a walker or if you got a device within the last 5 years, your insurance company is not going to pay for a second device. So let's say you broke your hip a couple years ago, you had a walker. You don't need the walker now, but you could use a cane. Your cheapest path is going to be Amazon, Walgreens, Walmart, CVS, and that's going to be the cheapest way to buy it. So things to think about, though, you're right, is that most of the canes are adjustable height. So this cane here is black and it has a little push button. What I want to do is I want to set the cane up so that if I am standing, so if I stand with my wrist, my arm relaxed, the top of the cane, the handle, should be about your wrist bone. That's just a general guide. You want to have a little bit, let's show it here, you want to have a little bend in your elbow. Some people's body is set up that their arms are longer or their legs are taller. So that height it's not a set in stone. So you want it to be comfortable. You don't want your shoulder up high. You don't want to have to bend down to get to the handle. So once you have the height adjusted, what you want to think about is which hand should I use the cane in? It's very common misconception that if this leg is weak or this leg is sore, I should use the cane on the same side. That's a misconception because that changes the way we walk. So if I use the cane on the right side, and the right side is the one I want to support, I start walking like this, okay? And that is going to lead to some leaning, probably some back pain over time. So what you want to think about is that normally when we walk, if I don't use the cane for a minute, normally when we walk, our body has a pre-wired motion, that alternate arm, alternate leg. That arm swing, leg swing, that's the pattern you want to use when you're using the cane. So if my right leg feels like it needs the support, I'm going to put the cane in the left hand, and the cane is going to go before or with that leg. So let's say you don't have a weak side, but you just feel a little off balance. Then I say to people to use the cane in whatever hand makes sense or feels best, but move it with the opposite leg. So I have several patients right now that are moving from 2 canes to 1 cane, or 2 crutches to 1 crutch, and they're going to use the cane in their non-dominant arm so they can do things with their stronger arm, which is great because both sides could use a little support. So that's the case for me. I'm going to use the cane with the right leg, but really as an extra balance point, and then my right hand's available.
Terrific.
So yeah, so we educate people on that all the time.
And so if someone is feeling like their balance is off, it's okay to just go out and you can get a cane and start using
I
the
think
cane.
so. I do. I don't think there's no risk of doing that. And if you have a cane that you inherited from a family member, if it's adjustable, try to use those tips I suggested. You want to be standing up tall around the wrist bone when your arm's out straight, and using it in the opposite side. Yeah, I don't think there's any downside to doing that.
Terrific. And so we've talked a lot about the risks and the prevention, and we have just a couple minutes left. Any words of advice to someone who has suffered a fall, and with that fall kind of comes some loss of mobility? Any suggestions about recovery? Can people recover from falls?
Yes, but it really, as you mentioned or Jen mentions, that it really takes a toll on your confidence. People's confidence after a fall, especially I found a fall on the stairs, really, really gets in your head, and you start to reduce what you do. You start to think about everything you do. You may not be as active. What I would encourage you to do is to take the advice of making your environment as safe as possible with lighting, reducing those hazards, whether it's the grandkids' toys, your kids' toys, the dog toys, the moving rugs in the house, stairwells and a sturdy stairwell going up the stairs, all those things. Make sure that you can make your everyday environment as safe as possible. And then the other thing you want to do is still get up and move. So we make a general suggestion to get up every hour. So get up every hour to change your position, keep your body moving, continue to build the strength.
Terrific. Well, thank you for all these wonderful suggestions, Kate and Jennifer. Great ideas to help protect yourself for prevention. We really, again, want to encourage people to come out to our Falls Free event on September 25th at Alvernia. I also want to encourage people that senior centers are a wonderful place to go. They have screenings. They do some evidence-based health and wellness programs. Matter of Balance Tower partners with us for some of those. And really to have those conversations with your doctor to kind of take that active approach in your health. Because falls with or without injury can really impact your life. A growing number of older adults, fear of falling, as you mentioned, Kate, that fear causes more risk, causes decreased mobility. And so really we hope you take something away from this program and go out and get screened and help prevent falls. So thank you for joining us, and we'll see you next month.